My healthcare provider informed me that as I get older, having a mammogram every year, plus a clinic visit spaced out within the year, would ensure that my breasts were being examined every 6 months. This seemed like a great plan in theory. Nothing could possibly be missed if someone was checking me for something twice a year, right? As it turns out, there was an enormous piece missing in my preventative care, and I wish more than anything that I could go back in time and change it. That missing piece was the fact that I had never been informed that I had dense breasts. When I was diagnosed, I was found to have stage 3C advanced stage cancer. What is so frightening to me is just 7 days earlier, I had had a 3D mammogram, which did not detect any abnormality in my breast. As I was receiving treatment, I read everything I could about breast cancer. Nobody in my family had breast cancer. And I began to wonder why, with all the preventative mammograms and preventative care I had received in the past, did my cancerous tumor get missed? It turns out everyone knew about my dense breasts. My doctors, the radiologist, the breast diagnostic clinic. Everyone knew but me.
If a screening mammogram is covered in order to detect breast cancer at an early stage, which we all agree is vital, then it logically follows that should a more effective screening modality be needed for women who have dense breasts in order to detect their cancer early, it should be covered as well. We're concerned that general practitioners may not have the depth of knowledge on risk assessment to have a meaningful and accurate conversation with their patients about what their density score really means. This is a relatively new and evolving field of study, despite having known for decades that it does mask tumors. At the very least, if we're going to notify a woman that she's at increased risk for breast cancer and that her mammogram may not be accurate due to her dense tissue, then we should ensure that we have a plan that treats all women equally as they plan their next best step.